There are at least 7 Medicare programs, protections, and rules already in place that can lower, cover, or completely eliminate costs many seniors pay every single month. 7. And before I go one sentence further, I need to clear up the biggest misunderstanding about this topic because it's the exact reason many people who qualify never apply. People assume Medicare assistance is only for someone with no savings, no pension, and almost no income. So if your home is paid off, you receive a retirement check, or you have money sitting in a savings account, you assume none of this applies to you. Other people assume that because they already have Medicare Advantage, everything available to them has been applied automatically. So they never check. And a third group sees the Medicare premium being deducted from their Social Security check every month and assumes that number is simply permanent. They assume there is no program, application, appeal, or correction that could lower it. All three groups can be wrong because Medicare is not one single bill. It's a stack of premiums, deductibles, co-payments, coinsurance, prescription costs, penalties, and uncovered charges. Each follows a different set of rules, and each may have a different program that helps pay it. One program may cover your monthly Part B premium. Another may reduce what you pay for prescriptions. Another can legally protect you from certain doctor bills. Another can help correct a penalty that was calculated using incomplete information. And another gives you the right to challenge a claim your plan refused to pay. The problem is that nobody automatically sits down with every American at age 65 and checks all 7. You have to know what exists, which question to ask, and who to call. So in this video, I'm walking you through 7 Medicare costs you may be able to lower, avoid, or stop paying for everyone. I'll explain who it helps, what mistake people make, and the exact question you should ask. Stay with me through number 2 because that one involves bills some Medicare beneficiaries are legally protected from paying, even when the bill looks completely official. And stay through number 7 because the first denial from Medicare or your plan does not always mean you owe the money. Let's start with the deduction most people notice every single month. Cost number 1, your monthly Medicare Part B premium. In 2026, the standard Medicare Part B premium is $202.90 per month. For many people, that amount is deducted directly from their Social Security payment before the money ever reaches their bank account. Most people look at that deduction and assume it can't be changed. But every state operates Medicare Savings Programs that can help qualifying Medicare beneficiaries pay Medicare costs. There are 4 main programs: QMB, SLMB, QI, and QDWI. Depending on which program you qualify for, your state may help pay your Part A premium, your Part B premium, or additional Medicare cost sharing. This is where the first expensive mistake happens. People ask whether they qualify for Medicaid. They're told no. Then they assume that automatically means they can't receive any help with Medicare. But Medicaid eligibility and Medicare Savings Program eligibility are not exactly the same question. Some states use more generous income or resource rules. Some states don't count certain income or assets the way people expect, and the limits can change. So don't disqualify yourself based on an old article, a number from another state, or something a friend was told 3 years ago. Here's exactly what to do. Call your state Medicaid office or your local state health insurance assistance program, usually called SHIP, and say, "Please screen me for every Medicare savings program available in this state, including QMB, SLMB, QI, and QDWI." Use the words Medicare Savings Program. Don't ask only whether you qualify for full Medicaid. If you qualify for one of these programs, the help may begin with the premium being deducted from your Social Security payment every month. Depending on the program, it may extend further. Now we get to the protection most people have never heard explained properly. Cost number 2. Doctor bills you may be legally protected from paying. The Qualified Medicare Beneficiary Program, usually called QMB, is one of the 4 Medicare Savings Programs, and QMB is not simply a coupon or a small discount. If you're enrolled in QMB, medical providers are generally prohibited from billing you for Medicare-covered deductibles, coinsurance, and copayments, but incorrect bills can still arrive. A doctor's billing system may generate the charge automatically. A hospital may send a statement. A collection notice may appear official and urgent. And many seniors pay immediately because they assume that receiving a bill means they legally owe it. That's the mistake. Imagine a woman named Carol. Carol receives Medicare and is enrolled in QMB, but she never understood what QMB actually protects her from. After an outpatient procedure, she receives a bill for several $100s labeled patient responsibility. It includes the doctor's name, the date of service, an account number, and a warning about late payment. Carol pays it because she doesn't want a collection account. But before paying, Carol should have contacted the provider and said, I am enrolled in the Qualified Medicare Beneficiary Program. Please verify whether QMB billing protections prohibit this charge. If you have QMB, keep evidence of your enrollment somewhere easy to reach. If a provider bills you for Medicare-covered cost sharing, contact the provider's billing department and your Medicare plan before sending payment. Not every medical bill is protected. Services Medicare doesn't cover. Elective services and other excluded charges may still be your responsibility. But the larger point is critical. An official-looking bill is not automatic proof that you legally owe the amount printed on it. If you're in QMB, check first. Cost number 3, Part D premiums, deductibles, and prescription copayments. The third program is called Extra Help. Extra Help is a federal program that assists qualifying Medicare beneficiaries with the cost of Medicare Part D prescription coverage. In 2026, people receiving full Extra Help can have a $0 premium and $0 deductible for an eligible drug plan. Copayments for covered prescriptions are also limited. The official 2026 limits list copayments of up to $5.10 for a generic covered drug and up to $12.65 for a covered brand name drug for most Extra Help recipients, with even lower amounts for those at the lowest income levels. Depending on the person's circumstances, some people receive Extra Help automatically because they already receive Medicaid, supplemental security income, or assistance through a Medicare Savings Program. Other people have to apply, and that's where thousands of people miss out. They assume that if nobody contacted them, they must not qualify, or they applied years ago, were denied, and never tried again after their income, savings, marital status, or household situation changed. There's another mistake that can happen even after a person receives Extra Help. Not every Part D plan charges exactly the same premium. Extra Help may cover the full premium of certain eligible plans, but if you remain enrolled in a more expensive plan, you may still pay the difference. So, qualifying for Extra Help is only the first question. The second question is whether your current plan is structured in a way that makes full use of the benefit. Call Social Security Medicare, or your SHIP counselor and ask, do I qualify for extra help? And would another Part D plan allow extra help to cover more of my current premium and prescription costs? Don't change plans blindly. Your medicines, pharmacy, formulary, and prior authorization rules matter. But don't assume that the amount you pay today is automatically the lowest amount available to you. Cost number 4, prescription expenses after you reach the annual limit. In 2026, people with Medicare Part D drug coverage have an annual out-of-pocket limit of $2,100 for covered Part D prescription drugs. Once qualifying out-of-pocket spending reaches that limit, the person pays no additional copayment or coinsurance for covered Part D drugs for the rest of that calendar year. But two misunderstandings create unnecessary confusion. First, the limit applies to drugs covered under your Part D plan. It doesn't mean every medication, supplement, medical product, or excluded drug becomes free. Second, the Medicare prescription payment plan is not the same thing as the annual spending limit. The payment plan can spread prescription expenses across monthly bills instead of requiring a large amount at the pharmacy counter. That may make cash flow easier, but it doesn't lower the total cost by itself. Imagine a man named Frank. Frank fills an expensive prescription in January and receives a painful pharmacy bill. He joins the Medicare prescription payment plan and assumes his medication became cheaper. It didn't. The program only distributed what he owed across monthly payments. The separate $2,100 annual Part D out-of-pocket limit is what eventually prevents new qualifying out-of-pocket charges for covered Part D drugs after the limit is reached. Call your Part D or Medicare Advantage drug plan and ask, how much qualifying out-of-pocket spending have I accumulated toward the 2026 Part D limit, and which of my prescriptions count toward it? Then ask, would the Medicare prescription payment plan help spread my expenses, and what would my estimated monthly payments be? One protection limits annual qualifying expenses, the other changes when you pay them. Know which one you're using. Cost number 5, paying for preventive care. Medicare may cover at no cost. Medicare. Part B covers many preventive services designed to detect health problems early or help prevent them entirely. For most covered preventive services, you pay nothing when you receive the service from a provider who accepts Medicare assignment and all coverage requirements are met. But the word preventive creates one of the most common billing surprises. A preventive visit and a visit to diagnose or treat a new medical problem are not always built the same way. Imagine that Susan schedules her Medicare annual wellness visit. During the visit, she asks the doctor to examine a new pain in her shoulder, review a worsening skin condition, and change one of her medications. The wellness visit itself may be covered without cost sharing, but the additional evaluation of new medical problems may be billed as a separate medically necessary service with the normal Part B deductible or coinsurance applying. Susan sees the bill and assumes the office made a mistake because she scheduled a free Medicare visit. The charge may be correct, but it shouldn't have been a surprise. Before a preventive appointment, ask, is this appointment being scheduled as my Medicare annual wellness visit? Then ask, could discussing or treating any additional medical problems today create a separate charge? You're not refusing treatment. You're simply asking to understand the billing rules before the service is provided. Also confirm that the provider accepts Medicare assignment and that the preventive service is being performed at the interval Medicare covers. The lesson isn't that every preventive appointment is completely free under every circumstance. The lesson is that many covered preventive services have no cost sharing when the requirements are met, and you should understand which part of the appointment Medicare considers preventive. Cost number 6, late enrollment penalties that may deserve a second look. Medicare, late enrollment penalties can follow a person for years. For Medicare Part B, the penalty generally increases the premium by 10% for each full 12-month period the person could have enrolled but didn't, unless an exception or special enrollment period applies. In 2026, the standard Part B premium is $202.90, so even a percentage-based penalty can become a meaningful recurring expense. Medicare Part D uses a different calculation. The Part D penalty generally equals 1% of the national base beneficiary premium, multiplied by the number of full uncovered months in which the person was eligible for Part D but lacked creditable prescription coverage. The 2026 national base beneficiary premium used for that calculation is $38.99. These penalties are real, and people shouldn't intentionally ignore Medicare enrollment deadlines. But the mistake is assuming every penalty calculation is automatically based on complete information. People retire at different ages. Some remain covered by an employer plan. Some have coverage through a working spouse. Others receive retiree coverage or COBRA and incorrectly assume it creates the same Medicare enrollment rights as coverage based on current employment. The rules can differ significantly. For example, COBRA generally does not extend the same Part B special enrollment period that active employment group coverage can provide. If you're being charged a penalty and believe you had qualifying coverage, don't simply ask, "Why is my Medicare premium so high?" Ask, "What exact months does Medicare say I was eligible but did not have qualifying coverage?" Then ask, "What documentation can I submit to prove the coverage I had during those months?" For Part D, request evidence from your previous insurer showing whether your prescription coverage was considered creditable. For Part B, collect employer coverage records and determine whether the coverage was based on current employment. A penalty shouldn't be challenged merely because it's expensive. It should be challenged when Medicare's coverage history is incomplete or incorrect. Now we reach the final cost, and this one can be larger than everything else on the list combined. Cost number 7, paying a bill after Medicare or your plan says no. A denial is not always the final answer. Original Medicare, Medicare Advantage plans, and Medicare Part D drug plans all have formal appeal procedures. The exact process depends on what type of Medicare coverage you have and what decision you're challenging, but the expensive mistake is nearly always the same. A person receives a denial notice, sees the words "not covered," and assumes there's nothing else to do. They pay the bill, they cancel a procedure, they stop trying to obtain a medication, or they give up because the notice looks final. But Medicare appeal systems generally contain multiple levels of review. Start by reading the denial notice carefully. Look for the exact reason the service, item, or drug was denied. Was it considered medically unnecessary? Was prior authorization missing? Was the provider out of network? Did the plan require a different drug to be tried first? Was documentation missing? The reason matters because the appeal has to answer that specific problem. Contact the doctor, hospital, pharmacy, or supplier and request records supporting the medical need for the service or drug. Then follow the appeal instructions and deadline printed on the notice. When you call, don't say only, "I want to complain about this bill." Say, "I want to appeal the coverage or payment decision." A customer service complaint and a formal appeal are not the same process. If waiting could seriously harm your health, ask whether you qualify for an expedited or fast appeal. Imagine that Helen's Medicare Advantage plan denies coverage for a treatment her doctor requested. Helen calls customer service, is told the claim was denied, and ends the conversation. That phone call did not necessarily begin a formal appeal. The better step is to request the written decision, identify the appeal deadline, obtain the doctor's supporting documentation, and submit the appeal through the process stated in the notice. The first no may remain a no. There are no guarantees, but it shouldn't automatically become a bill you pay without reviewing your appeal rights first. So here are all 7. 1. Ask to be screened for every Medicare Savings Program available in your state, not only for full Medicaid. 2. If you're enrolled in QMB, don't automatically pay Medicare deductibles, coinsurance, or co-payments a provider may be prohibited from billing you for. 3. Apply for extra help and verify whether your current Part D plan allows you to receive the greatest available assistance with premiums and prescriptions. 4. Track your 2026 Part D spending against the $2,100 annual out-of-pocket limit for covered drugs and understand that the Medicare prescription payment plan spreads costs but doesn't reduce them. 5. Use the preventive services Medicare covers, but ask before the appointment whether any additional care could create a separate charge. 6. Review a late enrollment penalty when Medicare's record of your previous coverage may be incomplete or incorrect. And 7. Appeal an incorrect denial instead of assuming the first decision is automatically final. None of this means every person watching qualifies for every program, and it doesn't mean every Medicare bill can legally be ignored. It means you should never keep paying a recurring Medicare expense simply because it appeared automatically on a statement or was deducted from your Social Security check. Find out which rule created the charge. Ask whether a program can help cover it. Check whether the amount was calculated correctly. And if a coverage decision is wrong, use the appeal rights already built into Medicare. Here's exactly what I want you to do this week. First, find your most recent Social Security statement and identify the Medicare premiums being deducted. Second, gather your Medicare card, Part D or Medicare Advantage plan card, current medication list, and any recent medical bills. Third, call your local SHIP program and request a complete Medicare cost review. Ask them to screen you for Medicare Savings Programs and extra help. Ask whether your current drug plan still fits your prescriptions and pharmacy. Ask whether any recurring penalty appears on your account, and bring any medical bill you don't understand. SHIP counseling is designed to help Medicare beneficiaries understand their options, and getting screened costs you nothing. Don't call and ask only, "Can you save me money?" Ask specific questions. Can you screen me for QMB, SLMB, QI, and QDWI? Can you check whether I qualify for extra help? Is my current drug plan making full use of that assistance? Am I being charged a late enrollment penalty? Do I have appeal rights on this denial? Those questions produce much better answers than simply asking what Medicare offers. This video is for general education and does not constitute medical, legal, tax, or individualized insurance advice. Eligibility limits, covered services, plan networks, formularies, and state rules vary. Always verify your personal situation with Medicare, Social Security, your state Medicaid office, your plan, or a qualified SHIP counselor before canceling coverage, refusing care, changing plans, or leaving a bill unpaid. If you know someone whose Medicare premium keeps rising, whose prescriptions are becoming unaffordable, or who recently received a medical bill they didn't expect, send them this video. One correct application, One corrected billing mistake or one successful appeal could be worth far more than the time it takes to make the call. And comment below with the Medicare cost that surprises you the most: the premium, the prescriptions, the co-payments, or the penalties. I read those comments because they tell me exactly which Medicare rule needs its own full video next. Take care of yourselves. Take care of your health.